A very good evening and welcome everyone. I, Dr. Ritika Dhiman, on behalf of Voice of Healthcare, welcomes all the speakers and the viewers who have joined in for today's discussion. On the occasion of World's Osteoporosis Day, Voice of Healthcare, in association with Dr. Reddy's Laboratories, has taken an initiative to bring together the experts and speakers for the panel discussion today, which aims to spread awareness regarding osteoporosis. With this discussion, we shall also dive into understanding the signs, symptoms, facts, and myths around osteoporosis. I would like to commence this session by introducing our eminent speakers. Dr. Manoj Khatri, he is a rheumatologist and immunologist, Jodhpur. Welcome, Dr. Manoj.
Most welcome. Thank you.
Dr. Mohinder Kaushal, Chairman and Managing Director, Trinity Hospital and Medical Research Institute, Zirakpur. He will be joining us shortly. Dr. Arnab Karmakar, Associate Professor at Department of Orthopedics, IPGME&R, Kolkata. Dr. Arnab will also join us shortly. So, starting with the discussion with Dr. Manoj. So, as it is an osteoporosis day today, so I would like to, ask you that what are the common signs and symptoms to look out for osteoporosis?
Okay. So, so I'll speak in Hindi or English. What kind of population? Who is the audience?
So we have both audience. You can,
Okay.
coordinate between both the
Okay.
languages.
Okay.
Yes.
Okay. So, osteoporosis is basically a disease where your bones become brittle. So they become weak. Okay. So what it causes is your bones can get fractured on a minor trauma, like slipping from on the floor or falling in the bathroom. These are the common accidents where you can have fractures. So this is basically a brittle bone disease where your bones become fragile and they get easily fractured. Till a patient develop a fracture, there is no symptom of osteoporosis. So it's completely a silent disease till it causes a fracture. Am I clear? So it is completely a silent disease till one get a fracture. Once patient develop fracture, the disease become obvious. Okay, so the common sites for fracture are your vertebral fracture and neck of femur fracture and wrist fracture. So these are the common sites of fracture, and we call them pathological fracture because it is because of the bone problems that we have seen. So osteoporosis, when it comes to signs and symptoms, there is no sign, there is no symptom till patient develop fracture. Very clear?
So, sir, if I want to know if I have osteoporosis, right? So you said there are no specific signs and symptoms. So if I develop a fracture, so will it be like I have developed a fracture, so I should get tested for or is there any sort of in which people can be aware that they have osteoporosis, they know that they have osteoporosis
Okay,
apart from
so
itself.
okay,
Yes.
so what happens is at the age of 30, your bones are the strongest. As the age passes after that, your bones become weaker and weaker. Okay, this occurs especially during menopause. At the time of menopause, the bone loss is very rapid. Okay, so what happens is your bones are likely to become weak over the age. Okay, so suppose you have developed a fracture, you are hardly of 40 years. Okay, and if you have developed a fracture which is pathological in nature, like on minor trauma, then we would be looking for osteoporosis as well as for the other causes of osteoporosis. Like if you have some other cause, you have been taking steroids, you have been taking alcohol, or you have had some other intestine disease, kidney disease, or liver disease, which can cause osteoporosis. Otherwise, in usual people who are not suffering from these diseases or who are not consuming the medications which can cause osteoporosis, we advise people to undergo DEXA scan. If if they are female, they have to undergo a DEXA scan after the age of 65, and a male should undergo a DEXA scan after the age of 70 years as routine screening for osteoporosis.
Right. So you have rightly said that we should be get screened routinely for osteoporosis after a certain age. Yes.
Exactly.
So, Dr. Manoj, what are the differences in prevention of osteoporosis in India and other countries like US or UK?
So as I told, DEXA is not readily available at peripheral sites in India. Okay, you can find it in Delhi, you can find it in Jodhpur. But if you go in the periphery, like Barmer or some other districts, you are not going to find DEXA machine over there. So it is not feasible for general population to undergo DEXA scan. Understand, so there are limitations in India. Other than that, it is not available in government hospitals very easily. So screening for general population is little bit difficult. But I want to tell you the disease is very common. At least 50 million people are suffering from osteoporosis in India. This is such a common disease, okay? And the screening is very important. Now, what we can do is, if, as I told you, we can do DEXA for each and every one. So we can check a FRAX score. There is a FRAX score which calculates the fracture risk in you. So you have multiple factors which can be used for that purpose, like your gender, age, alcohol consumption, steroid consumption, family history of fracture, any history of past fracture. There are a lot of factors which come into play. By using those factors, you can calculate a FRAX score for yourself, and that will give you an idea how much fracture risk do you have in next 5 years or 10 years. If the fracture risk is significant, then you are more likely to have osteoporosis, and such patients actually can be screened by DEXA machine for BMD to rule out osteoporosis. So, because the limitation of unavailability of DEXA machine, which is used for calculating the bone mineral density, what we can do is we can check the FRAX score of the population, like more than 65 years of female and more than 75 years of male. And in those people, if the FRAX score is high and the risk of fracture is high, we can consider doing DEXA for those limited number of patients. In UK and USA, DEXA is easily available investigation. So every female above the 65 and every male above the 70 should be screened for osteoporosis using BMD by DEXA machine.
Right. So you have
Okay.
mentioned that there is accessibility issue in India in terms of osteoporosis, and there are certain protocols that are need to be set, in terms of screening of osteoporosis. So Dr. Arnab is also here with us. So I would like to ask Dr. Arnab that fractures are the most common. Symptom or sign of osteoporosis. So, how common are spine fractures in osteoporosis, Dr. Arnab?
Yeah, hello. Good evening. Yeah, definitely. As the discussions was going on, I heard really main features the patient present to us, and they got discovered that they actually suffering from osteoporosis. These are fractures when they suffered fractures, and of these fractures, three are commonest. So spine being very common, and then the distal radius fracture and the fractures around the hip. Of late, definitely the spine fractures are very, very common, especially in female more than 60 years or male more than 70 years. And often they come to us having pain, which is not relieved by taking medications or over the counter painkiller. And on the X ray, to the contrary, we discover that there is a compression fracture of the spine. So this is very, very common, and this is very much neglected also. Because at the time when the patient presents to us, the time we actually discovered that they are actually suffering from osteoporosis, and now it is in severe stage that they are coming to us with fractures.
Yes, so you have rightly said that spine fractures are not there are a certain number of that is the patient has to have to come late in terms of spine fracture, and they got to know then that he has or she has spine fracture. So, Dr. Manoj, I would like to ask you that osteoporosis is commonly seen in women. So, what is the incidence of osteoporosis in male? How males are affected by osteoporosis?
Okay. So actually, osteoporosis is very age-dependent phenomena. Okay. At the age of 55, if you consider, only 1.5% of male will have osteoporosis and 3.5% of female will have osteoporosis. When it comes to around 65 years of age, 3% of male will have osteoporosis and 10% of female will have osteoporosis. And if you consider the age above 70, I'll tell you 30% of women and around 10% of male are suffering from osteoporosis. Okay. So as the population get aged, the prevalence of osteoporosis rises. So it is a common disease in female, but it is not uncommon in male at all, and it is completely a age-dependent phenomena.
Yes, so you have pointed out the risk factors for osteoporosis, right? The age is one factor, one risk factor, and the gender is one. That is, males can also have osteoporosis, but there is much less incidence as compared to women. So, Dr. Arnab, I would like to ask you that what are the unmet needs or expectations of patients and doctors from the government institutes in India in terms of osteoporosis?
Right. So I just want to add one point in the last discussion regarding the osteoporosis in male. So the thing is that because of our society and some taboos, we think that males are strong from their birth and they can't be having these type of diseases. And as society thinks that osteoporosis is a disease of females and it can only affect females. That is why we actually seldom looks for osteoporosis in male patients also. If I can share my experience that I write for DEXA scan in every female who is coming to me with back pain or something like after 50s or 60s. But for male, even to my practice also, the frequency of writing down DEXA scan is less compared to the male. So there is a lack of awareness in between us also. So we need to work among that. कि ऐसा बात है ना कि मर्द को दर्द नहीं होता है इस टाइप का जैसे कि मर्द को ऑस्टियोपोरोसिस नहीं होता है so it's a wrong concept it's another thing like that men do suffer from osteoporosis maybe a bit late but we actually do not look into them for the detection of osteoporosis that is what I want to add and regarding your questions that what government or government institutions should do I think the main problem of osteoporosis is being a very, very huge and silent killer is the lack of awareness in between the doctors, lack of awareness in between the common peoples also. So we think that DEXA scan is like something aristocracy, something sophistication. Even at a very late stage, it should be done, but it is not. It's a screening tool to detect osteoporosis. And the whole idea of talking about osteoporosis or discussing about osteoporosis is that we need to prevent it. We need to detect it at the very earliest stage and we need to prevent it so that we can prevent osteoporotic fractures and we can reduce the huge health burden because of these fractures in these older age group of people because this older age group of people if they suffer a fracture in the spine or suffer a fracture in the hip it's very difficult to come back to the previous pre-injury fitness level so our expectation from government institution or government is that they should do programs, they should do camps, they should include DEXA scan screening in all geriatric patients, and that should be implemented throughout the government, whether it's a private setup and everything. That should be. If you go to in a private hospital, there are multiple packages are available: cardiology package, diabetes package of investigation, but anywhere this DEXA scan is not included so that should be there that awareness should be there that after 60s the females and after 65 the males all health packages should include a DEXA scan I think this much of awareness is very much required to tackle osteoporosis in a broader sense so that we can prevent osteoporosis.
Right, you have rightly mentioned that there should be a package for osteoporosis as well in the government institutions, right? So, you have answered again one of the main questions that what can India do differently in terms of osteoporosis screening and prevention as it is in the screening is in US or UK. So you have included that as well in your answer. So there are certain questions from the audience as well, Dr. Arnab and Dr. Manoj. So I would like to, ask you that how do people know that they have osteoporosis and not just a normal pain? Dr. Arnab?
Yes, yes. So first of all, any pain is not normal. If there is a pain, there must be something. If it is due to injury or some trauma or something, then it's fine. That's a normal reaction of our body to react to any injury or trauma. But if it is of nowhere and if it is not going by say for 2 days or 3 days or taking after some painkillers, then definitely there might be some underlying reason. And as already we have discussed that the persons who are liable to get osteoporosis, like is there is a age factor, there is a comorbidity factor like diabetes, hyperparathyroidism, so certain types of endocrinal diseases, chronic malnutrition, people who are very thin, people who are very fat. So both of them. So any sort of these things, any sort of this type of patients who are liable to get osteoporosis, if they are having pain which is not easily going away, and along with that some other features are usually associated like fatigability, easy fatigability, sense of tiredness, sense of weakness, and pain which is usually radiates to a bone. That means if there is a starts with a knee pain, it can go to the whole leg, or if there is a spinal pain, it can go to the upper and it can involve the whole spine. So it's not limited to any specific point or specific area. So a broader sense of pain which increases with activity, relieves after taking rest and some medication, and it is not going away with some normal painkiller or normal rest, and which is associated with other symptoms which I already told. So if something and all this matches, then definitely osteoporosis should be excluded in these patients.
Rightly said, Dr. Arnab. So there is one more question that, what are the lifestyle changes that a person can do? Is osteoporosis a disease, which is linked to lifestyle changes as well?
Yes, definitely. So, see, osteoporosis is like a degenerative procedure. So as we grow old, the bones will become weak. So, as we grow old, our skin will not be always like very glossy and very shining, and our hair are also going to be white and it will fall off. So, as we take care of our hair, like as we use a good shampoo, as we sometimes put oil in our hair, as we put cream and moisturizer to our skin, so our bones also needs to taken care of. So that is what which is very very important is a good healthy lifestyle. So the human physiology is that if you put pressure on your bone at a very low threshold on regular basis, then it will make become strong, body will deposit more and more calcium. So that is what the importance of doing regular exercises, whether it may be walking, whether it may be some brisk exercises, whether you can go to gym or whether you can do yoga, but you should do some activity to make your bone strong. This is very very important and it should be done at regular basis. Then next is a matter of a healthy diet. So there should not be any deficiencies of vitamin D or vitamin B12, calcium, iron, ferritin, all these essential nutrients which are responsible for a good bone and muscle health should be maintained properly. So regular healthy diet, regular exercises, and screening at proper time. So as already we have discussed throughout this program that people who are responsible, who are susceptible to get osteoporosis, they should do this screening. And if you have some problem, some pain, fatigability, features of osteoporosis, muscle cramps, weakness in the body, generalized lack of energy, please visit your doctor, do check up for osteoporosis. It's not a very bad disease, it can be curable, and treatment is also very very easy nowadays.
Right, you have rightly mentioned the importance of regular exercise and having a good nutritious diet in osteoporosis. So, what do you think are the common challenges in management of osteoporotic patients from a doctor and a patient's perspective? So, what are the those challenges um, that you see in the management of these patients?
Right. So, in a patient who has come with a fracture, it's not very difficult because they are in that situation. So, whatever the doctor says, they will accept. Even if you ask them for any injections or something, they will accept it. But the persons who are getting osteoporosis, who are at the beginning stage of osteoporosis, if you say that you have to take this, you have to do exercise, you have to take medicines, you have to take one injection that every 6 months or something, then it's very difficult to make them understand, because they will say, doctor, I am having this much of problem, I can only take calcium, I can only take vitamin D. So their thinking is that at the present moment I am not having very huge issues, so why should I take that much of effort? But the thing is that we want to give the message to everybody who are seeing us, listening to us, that it's a treatment we are doing for the better future of your bone. It's not the for better today only. So our motto is to prevent any bad fracture. We can change the life of the patient. So fracture prevention, getting them a good healthy life. So this acceptance, I have think that has become more challenging in my patients. And second thing is that the adherence to the treatment protocol. Suppose you say, because the treatment of osteoporosis has to go on, it should not be stopped abruptly. It has to go on, and it should be uh, tailored as per the level of the osteoporosis of the patient, as per the need of the patient. So you should have a proper regular visit to the doctor, and you should continue and complete the treatment. Otherwise, the whole purpose is lost. So these two are the biggest challenges I have faced in my patients, that they don't accept it, or and when if they start the treatment, they don't adhere to the treatment protocol for long. So most of the patients are doing this, but again, I want to clear that this is for your better future. You may think that it's not that much of cumbersome or difficult today, but it can prevent a life-changing fracture scenario for you.
Right. So you have rightly pointed out, two things. One is ignorance, and second is consistency. So patients are usually ignorant of the fact that they have osteoporosis, and if one, treatment is started, then they are not consistent with the treatment or the guidelines that the doctors provide. Yes. Dr. Manoj is here back with us again. So, Dr. Manoj, we have one question from the audience as well. So, can osteoporosis occur in teenagers also?
As I told, osteoporosis can occur at any age, but there has to be some other cause. We call it secondary osteoporosis. Okay. So the osteoporosis that we see in old age is primary osteoporosis, and it can be secondary. Secondary might be because of anything, like a genetic disorder, which is called osteoporosis imperfecta. Okay. In that, basically, there is a genetic defect which makes your bone brittle, and the child may have fracture at the age of 1 year itself. Okay. At the during the birth, also the patient may develop or child may develop fractures. When it comes to secondary causes, which are environmental, so there are many causes, including one is drug use, like the drugs used for epilepsy, seizure disorders, steroids, uh, alcohol, if consumed in excess, can cause osteoporosis. Then sex hormones are very much required for bone strength. If the sex hormones are lost or they are not there because of a genetic defect or something, in such cases also it can cause osteoporosis. Hyperthyroidism, hyperparathyroidism, these are few more diseases where one can see osteoporosis. Okay. One more thing is the calcium and vitamin D are essential for bone strength. Okay. So if they are not absorbed from the gut, then also it can cause like celiac disease, IBD. All these diseases can cause malabsorption of calcium and vitamin D, leading to osteoporosis. Other than that, your body need to be healthy. If your liver is not working, then the proteins required for bone formation will not be formed. If your kidneys are not working, then it will create an environment where the bone health is not going to be good. The acidosis that it causes. So, in all these diseases, patient can develop osteoporosis early, but osteoporosis at the age of 8 or 10 is little unlikely. You can find it at the age of 25, 30 in various diseases. Osteoporosis at the age of 8 and 10 causing fracture is very unlikely.
Yes, so you have rightly said that there are certain diseases in which osteoporosis is one of the symptom of those diseases. Yeah. So you have said that we can also have osteoporosis in teenage as well. So what can we do to prevent? Is there anything we can do for the prevention of osteoporosis?
Okay. So adequate calcium and vitamin D intake in diet, and physical fitness, that is exercise. These two things do help. So calcium and vitamin D have to be adequate in diet. Calcium comes in milk and milk products, and when it comes to vitamin D, it is difficult to find adequate vitamin D intake in vegetarian diet. Mostly, it comes with fish, liver, and red meat. Okay. So if the calcium and vitamin D intake is adequate, then comes the role of exercises. Exercises are mandatory for bone strength. So the exercises which are weight bearing, like jumping, walking, running, these exercises increase your bone strength, and these exercises need to be continued for long. Moreover, fracture do not depend only on your bone strength; it depends on fall also. So fall has to be prevented. To prevent the fall, you have to modify your bathroom. If it is slippery, you have to change the tiles in your bathroom. If you have your eyesight is weak, you need to keep the glasses with you. You have to wear them always. At the age of 70, the patient get up from the chair without glasses and with low vision, he fall down. So these things also need to be kept in mind. Not only bone health, but prevention of fall is also important. Fall is a cause of fracture and osteoporosis. If the gait is defective, there are certain neurological disorders where gait is defective. Uh, Feet are not sensible; they are not sensitive. You can find the sense of ground or floor. In those conditions, also the falls are very common, and then these fall are cause of fracture in osteoporosis. Okay.
Yes, so you have said the two basic preventive, preventive treatment sort of that weight bearing exercise is the one, and the nutritional diet which contains calcium and vitamin D is one. Dr. Arnab, I would like to ask you if you are there. That what are the new advancements in the screening of osteoporosis, and at what extent are these advanced screening and treatment method accessible and affordable in India?
Okay. So obviously, the only test which is recommended currently is BMD measurement by DEXA scan. DEXA scan, because there is no awareness, or the awareness among the general population is low, and the utilization of scan is low in India. So the laboratories are not buying it, considering the low return after buying it. Cost vary from 1,000 to 4,000 between the laboratories which do DEXA scan. So in periphery, where the population is low or they are not very aware about the disease, or DEXA is not easily available. But you come to a metro city or even the second tier city, DEXA scan is mostly available. So availability is not an issue at two-tier study, two-tier or second-tier cities. But in periphery, DEXA is not easily available. And unluckily, there is no easy way to screen for BMD other than DEXA scan.
Right. So you have rightly mentioned that India needs to work on making it accessible and affordable. So, Dr. Arnab, are you there?
I'm here.
Yes, I think we have lost Dr. Arnab. Dr. Manoj, are there any, common, we can say that, fractures which are the main highlight of osteoporosis? Like if I am there and I see these fractures happening more commonly, are there
Hello.
any?
Am I audible?
Yes, yes, Dr. Manoj, you are audible.
So vertebral fracture and neck of femur fracture, these are two most important fractures that we see. Other than that, the fractures of long bones are also common. They are not uncommon. Fracture of distal radius, that is called Colles fracture, is also common. The most dreaded one is obviously fracture of neck of femur.
Right. So you have mentioned certain fractures, which are commonly seen in osteoporosis. Dr. Mohinder is also with us.
Can't
Hello,
hear
Dr.
your voice.
Hello. Am I audible, Dr. Mohinder?
I can't hear your voice, and neither I can hear the speaker.
I think you need to turn up your device volume, sir. Hello, is that fine, Dr. Mohinder?
ऑडियो ज्वाइन नहीं करी आपने?
I think he's not able to hear us.
Ritika, I am not able to listen to the speaker and to your voice.
Sir, there must be some technical glitch, while joining.
I can't.
You can
कल का प्लान आउट कर लो फिर इस लेडी को कब
you can
करना है
इस
तो
लेडी
rejoin.
को प्रॉपर तुमने क्लिनिकल एग्जामिन किया जो आई है मनाली वाली?
I think we have lost Dr. Mohinder now. So, Dr. Manoj, from a doctor's point of perspective, so how frequently do we need a DEXA scan?
single DEXA scan will not suffice in my city actually. Okay. So routine DEXA scan which is available in 10 to 12 lakhs will take at least 15 minutes for one patient to do DEXA. Okay. Even if you work for 12 hours, you can do more than around 50, 60 DEXA. This is what you can do with a machine. If it comes to how much population is affected, I'll tell you around 3 to 4% of population is affected by osteoporosis. So there's a large need of DEXA machines if you want to screen population. If a government has a scheme to do DEXA for every patient who is suspected for osteoporosis, then one or two machines are not going to suffice. There's great need of machines for screening. Uh,
Right. So are there any set protocols which you, as a doctor, think, apart from DEXA, that can be set, to make the early diagnosis of osteoporosis?
Diagnosis of osteoporosis is made only based on DEXA. We check BMD, bone mineral density, and then we calculate T score. If T score is less than minus 2.5, we call it osteoporosis. One definition. Second definition is if the patient has developed osteoporotic fracture. So if the patient has not developed fracture till now, and you want to diagnose osteoporosis, you need a DEXA. There's no way out. Okay. Now what we can do is, as I told you, we can calculate the FRAX score before going ahead with DEXA because of limitation or unavailability of DEXA. We can choose the people who are at risk, whom should we consider preferably for DEXA. For that, we can do a FRAX score calculation, which is simply a questionnaire. We have to fill age, gender, race of the person, and all that. 10, 12 questions. With that, you can find the fracture risk. If the risk is high, you can consider doing BMD by DEXA scan.
Yes, you have, rightly said that FRAX score can be also be one of the methods in which we can measure it. So I have one question from the audience that which is the medicine to cure osteoporosis? What are the treatment options that are available for osteoporosis in India?
Okay. For treatment of osteoporosis is very straightforward once somebody has been diagnosed. We look for how severe is the osteoporosis. If it is very severe, then we have limited options like teriparatide injection or romosozumab. If the osteoporosis is mild, then we have option of using dronades, alendronate, zoledronate, and certain things. In all the cases, patient will need to be treated along with that with calcium and vitamin D. The calcium and vitamin D supplementation has to be given. Then there are certain drugs which can be used in if there is secondary cause of osteoporosis, like kidney disease, liver, intestine disease, or there's deficiency of sex hormones, there's hyperparathyroidism. So the primary cause has to be treated. So we treat primary cause, which is causing osteoporosis. Then we give calcium and vitamin D in adequate doses, and then we treat with the specific molecules which are available. So indication depends on what the comorbidities patients have. The patient has kidney disease, then we have more limited options. We can use teriparatide, we can use dronate. So we have denosumab, which is one option. So it depends what are the how severe is the osteoporosis. First thing, what is the cause of osteoporosis, whether it is primary osteoporosis or secondary osteoporosis, and any comorbid like patient's kidneys are functioning fine or not. On those basis, we can decide what drug to be given. So drugs are available in multiple forms. Teriparatide is given by injection. Dronates are available by oral as well as injectable options are also there. Denosumab can be is given subcutaneous injection. So there are options, and we can discuss with the patient what options they prefer over one over the because treatment becomes costly at certain times, and it might not be pocket friendly every time.
Right.
So so it has to be discussed with the patient if the patient has some insurance which covers this the treatment, or it is easily available in government hospital where the patient is showing. So there are multiple factors which decide on treatment modality in India.
Right. So you have mentioned that you can modify the treatment according to the patient. So, Dr. Arnab, if you are you there, Dr. Arnab? Dr. Arnab, I think we have some connection issue with him. So, so there is one more question from the audience, Dr. Manoj, that can patient take vitamin D3 and calcium every day for osteoporosis treatment as a cure for osteoporosis?
There is no cure for osteoporosis. Okay. We just want to prevent it. Okay, we want to prevent a fracture. Somebody who has developed osteoporosis, he is going to need long-term treatment to prevent a fracture. Osteoporosis, as I told, is no way harmful until unless it causes fracture. Okay. When it comes to treatment, vitamin D and calcium supplement is just a basic drug that need to be given, but that do not suffice. Along with that, patient will need other drugs so that this calcium and vitamin D get deposited in the bone. So definitely, if somebody has osteoporosis, calcium and vitamin D supplementation will be required, but it is not adequate for treatment. Okay. When it comes to prevention of osteoporosis, we can prevent it. For that, you need to take adequate amount of calcium and vitamin D in diet. If you are not able to do so, calcium and vitamin D can be taken in oral form, in form of tablet.
So you have said that vitamin 3 and calcium can be a part of the treatment, and it can be part of preventive treatment as well for osteoporosis. So if a person is diabetic, so how best he can prevent himself from osteoporosis? Is there any link between diabetes and osteoporosis?
See, patients of diabetes are at little higher risk of osteoporosis, but it is not a very great risk factor. Okay. So it will provide the osteoporosis 2 or 5 years before the usual age, but it is not a very great risk factor for osteoporosis. But if the patient with diabetes develops CKD, kidney disease, then it becomes a risk factor for osteoporosis. Okay. Other thing is it can affect your eyes. The vision might go down, so it may cause fracture in patient of osteoporosis.
Right.
It
So
can
in
cause
common, yes.
it can cause neuropathy. So fall will become more common in patients of diabetes than non-diabetic patients. So osteoporosis all alone is not at all harmful. If you prevent fall in these patients, the risk of fracture will go down.
Yes, so you are mentioning that fracture is the main culprit in this disease, if I'm rightly getting your point, right? So yes, so I would so you like to conclude this discussion with something you want to make people something aware about something, or you want to say something to the people who are watching you in this session? What you would
So
like to say? Dr. Manoj?
This is 20th October. We are just increasing the awareness of osteoporosis. So you have to understand osteoporosis is very common disease, very common disease. Okay. Associated with rising age. So how to prevent it? You have to take adequate amount of calcium and vitamin D in your diet. Then you need to undergo regular exercises. These three things are important. And even if you do all that, still by after the age of 65 for a female and after the age of 70 for a male, it is necessary to undergo a DEXA scan. And if it is supportive of osteoporosis, you need to see an orthopedician, physician, or rheumatologist or endocrinologist, whomever you want to see. There are multiple branches who treat osteoporosis. One more thing, if you have risk factor, like if you have family history of fracture, you are using a lot of alcohol, you are consuming certain medications which can cause osteoporosis, you are hyperparathyroidism, you have kidney disease, then you need to see a rheumatologist early to look if there is osteoporosis or not to prevent a fracture. So I want to tell you, keep in mind there's a disease called osteoporosis, which is going to affect you on one day if you live long. Right. So to prevent it early, you have to do exercises, take calcium and vitamin D in the diet, and at the correct age get screened so that if you have osteoporosis, we can find it early and prevent a fracture.
Yes, so you have mentioned that screening can be done at the right age. What is the right age? Is it to 65 years of age or before that?
65 for female, 70 for male. With no risk factor.
Right. So, to sum this up, we have discussed about the signs and symptoms, fracture as the main culprit, and to prevent it, we need to, exercise, do weight-bearing exercises, and have a rich calcium and vitamin D in our diet to prevent osteoporosis. And if the proper screening should be done at the age of 65 in females and at the age of 70 in males. And if you have developed osteoporosis, you there is a treatment which we should not forget that there is a treatment, but you should be very consistent about the treatment. So thank you so much, Dr. Manoj, Dr. Arnab, for we are very delighted to have you as our panelist. So thank you so much, Dr. Arnab. Thank you so much, our viewers who have watched in for this session today. We have a very wonderful and insightful session.